coming out of 2019 and I was going through an earnings call, I had said that we were very much looking forward to 2020. We had created a profit for ourselves in the fourth quarter, and we were looking to extend that profitability throughout 2020. Unfortunately, COVID hit around the middle part of February and everybody started to feel it, and we started seeing clinics closing down. We stayed close to our customers, developing Zoom meetings for our customers to remain up to date on the latest technology, as well as the latest indications and the works that we were working on with CMS, which we did very intently during the course of the year in helping our customers gain additional reimbursement values for the coding that they used. We are still excited for 2021. We think that although we were looking forward to an exciting 2020, we will skip forward to 2021. So as we go into 2021, our existing customers will realize additional reimbursement for treating skin cancer and keloids. We continue to work with the Centers for Medicare and Medicaid Services because there is a path to further developing the reimbursement codes for our clients and for our patients. And the main reason for all of this is if there is slightly better reimbursement, it makes the equipment more available to more patients. And we don't have a shortage of patients in this country who are suffering with skin cancer. There are 6 million, and it's growing at 6% annually, which is a lot. But when you look at the number of physicians who can actually treat skin cancer, mainly through Mohs surgery, the numbers are very, very drastically different. And there's more patients than there are doctors. So the fact that we have superficial radiation therapy, it will continue to help doctors be productive and will help them in their cash flow. As a matter of fact, we learned a very important lesson as we went through the COVID period. We learned that the last machine that our doctors turned off before they had to shut down their clinics was the superficial radiation therapy system. And when they reopened their clinics 8 to 10 weeks later, the first machine that they turned on was superficial radiation therapy. As we found out, the profile of the patient going through COVID, over 65, having pre-existing conditions such as diabetics, hypertension, heart conditions requiring blood thinners, are very much the same profile that our patients for skin cancer have. And so that commonality provided our doctors with perhaps what we would consider a new normal. And we always said to ourselves, as we're coming out of COVID, as we're going into this new era, there will be a new normal. We want to be in control of that new normal and not allow that new normal or that new standard to impact us as much as we want to impact it. And so discovering these things during the COVID period has really helped us, helped our customers. And I think that we'll realize that we still won't have waiting rooms packed with surgical patients and or aesthetic patients, but we're going to have it packed with patients which have a lot more time in between. And if the doctors are to still treat the patients that they have in the backlog of skin cancer, SRT is certainly a fine tool for them to use that will increase their productivity. They'll be able to do more skin cancer patients than ever before in combination with Mohs surgery, but it will also impact their reimbursement and their cash flow as we have new reimbursements for them from CMS.